So you see a lot of family members that you don't typically see every day on Thanksgiving Day. It's a great time to catch up with everyone about, work or school, what's happening in their lives. But what about your health? Karen Powell is a genetic counselor at the Cone Health Cancer Center at Wesley Long Hospital, and she's here to tell us more about how to make this a conversation starter and why we need to make family health history so important in our conversations. Good morning.
Good morning.
And you just shared a very fun fact with me.
Yeah.
Thanksgiving Day is actually Family Health History Day, right?
Yes. The Surgeon General named Thanksgiving Family Health History Day maybe about 10 years ago.
Oh, wow. Didn't even know that.
Yeah.
It's so important to know your family's health history and know what you may or may not be predisposed to, right?
Yes, it's very helpful to have information about your family health history in order to be able to determine what you may be at risk for and hopefully take measures to reduce your risk for developing whatever disease is running in your family.
And it's not something that families actually talk about a lot. They don't talk about, well, this person has type 2 diabetes, or this person has is taking blood pressure medication. But it's something that you need to know.
It is something that you need to know. We see a lot of families through our clinic who will come in and have no idea about their family history, whether it be of cancer or other common hereditary diseases. And it's really a gift to be able to give this information to your family members. It's hard to start those conversations too, because certainly sitting around the dinner table on Thanksgiving, the last thing you really want to talk about is what ails you. But that information is going to be so beneficial to all of the family members, and especially if you have a matriarch or a patriarch of your family who knows more information further back. Getting that information is going to be very helpful.
Yeah, and even just started out by saying, ask that matriarch or patriarch, where were you born? Did you have brothers and sisters that, that we haven't met, or things like that?
Right, and just asking a little bit about where they grew up, what information they have about their parents, their aunts and uncles, their grandparents. What was it that great-grandma Jones passed away from? That information is going to be very beneficial, especially if you end up developing some sort of disease like breast cancer, colon cancer, or other types of common hereditary conditions.
And asking that question, Mom, Dad, are there any diseases that run in the family? Because it's not something that you typically would talk about, but it's something that will draw everybody in, I think.
Well, it is, and a lot of times people don't talk about this information in front of children.
Mm-hmm.
So if grandparents or aunts and uncles develop some sort of disease, the children don't know about it because the parents don't want to worry them or don't want to give that information to the younger generation because they feel like they're too young. But ultimately, that is information that will need to be passed on.
Right. And it's so beneficial to know this before something happens, before something develops.
Yes.
Thank you so much for being with us today.
Thank you for having me.
We do appreciate it. Again, Thanksgiving is National Family Health History Day, and that is all about encouraging those conversations about your family and your family health. You can go to Genetic Counseling Services at Cone Health to learn about any health risks you may have. Find out more about that at conehealth.com/genetics.
House Call on Fox 8 is sponsored by Cone Health.